Hello and good evening. It is now 19:05 in London. I'm Luke Addison.
And I'm Nikki Scott.
And welcome to Together Talks. What a great evening we had with Adam on our last episode. We learnt the importance of knowing where our food comes from, why the education around that is just as essential, and we learnt some tips and tricks for how we can be a little more conscious about what we are eating. We hope that you enjoyed it as much as we did. We're pretty sure that you did, as the video now has nearly 3,300 views.
Yes, that's great, Luke. A topic of really wide appeal, clearly. And the rest of series 2 is definitely going to keep building on that. As some of you are watching may know, the 24th of October is World Polio Day. And this is particularly important for Rotarians. But today we're going to learn why it's important for everyone around the globe, especially our children. In 1988, when Rotary first announced the partnership with the World Health Organization, and wild polio virus was endemic in more than 125 countries on 5 continents, paralyzing more than 1,000 children every day.
Understandably, polio was once a disease feared worldwide, striking suddenly and paralyzing mainly children under 5 for life. Thanks to the Global Polio Eradication Initiative, the largest private-public partnership for health, the wild polio virus has been reduced to just 129 cases this year to date, 77 in Pakistan and 52 in Afghanistan. Polio now survives only among the world's poorest and most marginalized communities, where it hits the most vulnerable children. The initiative's goal is to reach every last child with a polio vaccine and ensure a polio-free world for future generations.
Wouldn't that be marvelous? Together with the World Health Organization and the Centre for Disease Control, Rotary has been working to eradicate polio for more than 40 years, both financially and as boots on the ground under the National Immunizations Days programs, with generous financial support from the Gates Foundation. As Bill Gates himself said, the world's progress in fighting polio might be one of the best kept secrets in global health. With over 2.5 billion children now vaccinated, and as recently as 25th of August this year, Nigeria, and therefore the entire continent of Africa, was certified as being 3 years polio-free, an extraordinary achievement. And recognition was given when Rotarian Dr. Tunju Funsho, chair of Rotary's Nigeria National Polio Plus Committee, was named one of Time's 100 most influential people on 22nd of September. But our work is not yet done, and we're going to learn a lot more about that tonight. As the CDC have stated clearly, a polio case anywhere is a polio threat everywhere. If all eradication efforts stop today, and within 10 years, polio could paralyze as many as 200,000 children each year, and years of great progress would become undone.
We are so incredibly lucky to be joined this evening by Michel Zaffran, Director of Polio Eradication at the World Health Organization. Michel joined the WHO in 1987, where he has held various technical positions before becoming the Program Manager of the Vaccines and Biologicals Department. In April 2012 to January 2016, he headed the World Health Organization's expanded program on immunization and was the co-chair of the Immunization Systems Management Group of the Global Polio Eradication Initiative. And since February 2016, he has been the Director of Polio Eradication at WHO and chair of the GPEI Strategy Committee.
We're extremely lucky to have Michel here with us tonight on a very busy week to talk about the plethora of lessons learned during his incredible journey, working with and coordinating the teams that are aiming to eradicate polio for good. In these uncertain times that we are facing right now, this global pandemic, we are sure there is so much that we can learn from Michel and his team. So let's go ahead and play Michel's intro video, please.
Hello, my name is Michel Zaffran. I am the director of the Global Polio Eradication Initiative at the World Health Organization. I started working back in 1987 as a specialist in solar energy to help increase the use of solar energy to power the vaccine cold chain. It's great to be involved in the polio eradication program, Polio Plus, because you get to meet so many great people, including Rotarians all over the world. I will be retiring soon at the end of this year, but I will remain involved. I'm a Rotarian myself and will be president of my club in France in District 1710, and will make sure that we continue to support Polio Plus all the way.
So with any luck, by the wonders of technology, we would now like to welcome Michel all the way from Geneva. Come on in, Michel, and good evening. Good
Hello,
evening.
Michel.
Hello, good evening. Thanks to Rotary's Polio Plus effort, as you've heard from Nikki, the disease, poliomyelitis, has been reduced by 99%. As you've heard also from Nikki, Africa is now free of wild poliovirus. This is an extraordinary achievement. The virus was remaining in Nigeria, northeastern Nigeria, in a place where Boko Haram, the insurgency group, was actually trapping the population and preventing them from getting access to vaccination or exiting that area. So the fact that we now have been able to eradicate the virus entirely and not see spread throughout Africa is extraordinary. And this was done thanks to a lot of innovative strategies, innovative technologies. We actually used satellite maps to track settlements that were still inhabited. We also used GPS technologies to track the vaccinators and ensure that the coverage of vaccination was efficient and effective. An extraordinary achievement. But while poliovirus remains now in 2 countries, Pakistan and Afghanistan, and as you know, and as we know now from the COVID pandemic, beyond any doubt, infectious diseases spread like fire. Polio will not stay confined to Pakistan and Afghanistan. It will resurge globally unless we eradicate it entirely. In this COVID era, our objective is more urgent than ever. COVID is leaving children around the world more vulnerable to vaccine-preventable diseases such as polio. We must absolutely redouble our efforts to protect the most vulnerable children. We can also be proud that in these times of a pandemic, the Polio Plus infrastructure has once again demonstrated its broad benefits. The polio workers have actually helped support response to COVID-19. They have conducted surveillance. They have identified cases of people infected with COVID-19. They've traced contacts of these cases. They've used the laboratory network to confirm that the virus was there. They've managed the data. They've helped communicate the facts and fight the rumors. They've trained frontline workers on proper infection prevention and control practices to ensure that they would also convey that to the communities. The polio infrastructure helps well beyond polio eradication. Sadly, and as has been the case in polio so far also, some of our workers have lost their lives in this. We already have 3 of our health workers who actually have died in Somalia and in Afghanistan of COVID because they were doing their COVID work. Supporting Polio Plus not only protects children from polio, but indeed helps respond to other global public health needs. It is now totally obvious that the infrastructure that our funding, your funding, has helped put together in these countries needs to stay and can serve a much broader public health agenda and help countries in their preparedness strategies and response to other emergencies, whatever emergency comes up. So we must continue our efforts. We, however difficult and challenging the times are, we cannot and we must not give up.
Thank you so much, Michel. That's a very passionate plea, and quite right too. I mean, you've invested many, many years of your entire career into this battle against polio. And I think we'd like to start off, as you know, tonight, looking at some of the lessons that have been learned over the course of your career that we could make sure that we're all capitalizing on moving into this situation with COVID-19. What are some of the first lessons that come to mind that you think are relevant for people working on the COVID situation, specifically to take into account?
Well, I would say that the first most important lesson, which applies to polio, but applies to everything, is the spirit of the partnership. And, early on, Luc said, this is a public-private partnership, the largest ever. Having a public-private partnership, having governments, having civil society organization, at the grassroots level, having scientists, all of these involved throughout the world, and each one bringing his or her sort of skills to the partnership, and a good collaboration of all of these sort of skills is what has helped us move so far. As I told you earlier, we actually use satellite imagery of the Boko Haram area. Where did we get those imagery? Well, we went to NASA in the US, and we were able to get very, very precise maps from these areas. We actually use our network throughout the partnership, the 6 partners that are leading these efforts, to actually get access to the best skills all over the world and collaborate into one goal that we had set together. So partnership is an extraordinary power.
Absolutely. And I think, when we were talking previously, Michel, you also talked about some of the lessons learned in which infrastructure is needed to get some of the remotest parts of the world in providing these vaccinations, which of course with polio initially was an oral vaccine, and going forward may be even harder, right, with different ways to administer vaccines.
Absolutely. So very early on, in fact, that was done for the whole immunization program. We always thought that we needed a small indicator that would tell us whether the vaccine, which are heat-sensitive materials, biologicals, whether the vaccine was still good or not, because you need to keep it in a refrigerator. There's no energy in many of these places. So it's difficult to keep a vaccine cold. So first of all, a lot of equipment was developed and purchased, sometimes thanks to Rotarian money, to actually equip what we call the cold chain. But we also developed this small time-sensitive indicators, which is a color label that actually changes color over time. We call it a vaccine vial monitor. Each one of the vaccine vials that we now purchase has on its label a small vaccine vial monitor, which changes gradually color as it is exposed to temperature and heat over time. So when the color reaches a certain level, the health worker knows the vaccine should not be used anymore. If on the other hand, the color is correct, you can use it, which means that they can also take the vaccine outside of the fridge for a period of time, and still use it because the health worker can check that the vaccine is still good. Extraordinary tool, which has helped us reach to very remote areas.
Fantastic. It's wonderful to think that so much of the work that has been done already is going to reach beyond the polio program. Not to say that's finished, but Luc, I'm going to hand it over to you because I know we have several questions coming in and several questions that were asked in advance.
Sure. So thanks so much, Michel. I think we'll start off with quite an interesting question sent in by Janine Burtwhistle, who herself is a Rotarian working very closely with the polio project. She's asking, there are so few cases of polio remaining. Does it really matter if we carry on with the polio campaign when COVID-19 is now such a threat? Can we just leave polio at the point that it is?
Well, Janine, we have actually a real life experience of this. For 3 months, we've stopped vaccination campaigns in Pakistan, Afghanistan, and in Africa. And the number of cases has started to explode exponentially. If we leave the virus to circulate, it will basically spread. At the moment, it stays within the borders of Pakistan, Afghanistan, because some of these borders are closed. But I don't know how long it will remain within those borders if we don't vaccinate. So it's absolutely critical that we finish with this virus forever. Otherwise it will spread again. As Nikki said in her introductory remarks, within 10 years, we'll have 200,000 cases all over the world. So we don't only need to vaccinate in Pakistan, Afghanistan, of course, to finish with the virus, but we also need to continue to vaccinate approximately 400 million kids in countries in Africa and Southeast Asia, in the Middle East, to actually ensure that if the virus was to get out, there would not be an outbreak and the disease would not reestablish itself. And that's why it's costing so much money.
Brilliant. And another question, Michel, on the sort of Rotary level from Gillian Pierce is, in your opinion, what was the greatest impact that Rotary has made for you in regards to polio eradication?
Well, I think this hour would not be long enough to actually cite all of the contributions that Rotarians have made. Let's start with the first and most important one. Rotary International Rotarians had first the vision of a world free of polio. They launched that effort back in 1985. But before that, they had started to vaccinate in the Philippines against polio. So that was the vision first, and that vision was brought along for the World Health Assembly. That means the ministers of health of 194 countries around the world to endorse a resolution to eradicate the disease. Rotarians have been able to raise funds individually, in their clubs, in their district, but also advocate with governments. The UK government recently announced £400 million towards the polio eradication initiative. And, you speak of New Zealand, of Canada, of Australia, other countries where Rotarians have been instrumental in making sure that funding would be mobilized. I'm not speaking about the US. You know that the US has decided to withdraw from the World Health Organization. Nonetheless, Rotary has been able to actually convince the US Congress to continue to finance the program. So in terms of fundraising, it's extraordinary, but also at the grassroots level, the work that Rotarians have done in India, in Pakistan, in many countries to actually mobilize the parents to bring their children to the vaccination booth is extraordinary. So, Rotary has been present throughout. And now in Pakistan, one of the problems we're facing is the acceptation of the communities of this vaccination program. And Rotarians have actually sort of realized that some of these communities lack a lot of other services. So they're financing safe water systems so that, the community is not only benefiting from the vaccination against polio, but also sees that, we're doing more for them to bring safe water, to bring sort of healthy products also to them. So Rotarians are limitless sort of a contribution to the program, and without them, never would we be so close to finishing the job.
Just one last question from me, Michel. I was going to ask a question that was asked about what Rotary clubs can do, but you kind of answered that in your question. So just a question of my own would be, what advice would you have to young people that are interested in doing some work, campaigning for or even working towards eradicating polio?
Well, first of all, for young people that don't know what polio is get to learn what polio is or was. You're young, you never had a classmate who had contracted polio. And it's important to realize for people of my age or older that this is a really debilitating disease, a terrible disease. And we don't see it anymore in the UK and France. We don't see it anymore, but it is a very, very terrible disease. So first learn about it and then speak about it, and speak to your neighbors, to your friends about it. Say, we're about to eradicate the second human disease on Earth ever, after smallpox. No other human disease has ever been eradicated. So, raising awareness of the extraordinary work that has been done, but what remains to be done, so that, you speak about it and, convey also to everyone that vaccines work. There's a lot of sort of hesitation at the moment, especially in our countries, against vaccination. Is this safe to get vaccinated against flu, against measles, against a number of other diseases? Vaccines work and save lives, because children are still dying in the countries that don't have the benefit of these vaccination programs. We are so lucky that our kids can be vaccinated and protected from these diseases. But if we stop vaccination, the disease will come back.
Awesome, thank you.
Yeah, scary thought. In fact, you're touching right on a question from Colin McCarthy, Michel. It says, what is the key message we should be sharing in local publicity? Is it simply vaccines work, or is there something better, or something a little bit more specific that we could be saying to work against this movement anti-vaccines?
I'm not a communication specialist, so it's difficult for me to tell. But, when I speak to my friends, my family, I find people who are skeptical about the vaccine. And, I take them back to the basics. Basics is those diseases used to kill. They don't kill anymore in our countries, but they kill in other countries, or they they sort of paralyzed in other countries. And, you know, one person infected can transmit the disease. It's the same with flu. It's the same with COVID. It's the same with polio. So if you don't, it's the same with measles. If you don't protect yourself or protect your kids, you can be responsible for another kid being infected and sort of dying from the disease. So it's really the responsibility that you don't only vaccinate to protect yourself, but you also use the vaccine to ensure that you're not going to transmit the disease.
And Michel, I know, going back to some of the lessons learned, we were talking about some of the challenges you had to overcome in Pakistan and Afghanistan specifically with anti-vaccine campaigns and misinformation. Could you tell us a little bit about that, please?
Yeah, well, this is still not over, unfortunately. Back in, I mean, this has been an ongoing problem. It actually hit us in Nigeria for a period of time. Nigeria sort of fell to these anti-vaccination rumors, and as a result, vaccination stopped for several months in Nigeria. And that was the start of a big epidemic throughout Africa and the Middle East. We have the same problem in Pakistan. Last year, we were vaccinating in Peshawar, which is northeast of the country, an important vaccination campaign in an area where there's a lot of polio. And for, I would say, political reason, more than anything else, rumors were spread, and now they spread much faster on Facebook, on WhatsApp, through the social networks. Rumors spread that children were dying after the vaccinators had come to their houses. And some vaccinators were actually attacked by the communities. Some of them lost their life. And the vaccination campaigns had to be canceled and stopped. And 1 year after, I was sort of visiting Pakistan in a completely different province at the south of Pakistan. And we were trying to speak to parents who actually did not want their children to be vaccinated. So trying to understand, why don't you want your kid to be vaccinated? It's important. The answer was, well, you know what happened in Peshawar? Oh, children were dying. We don't want that. So that rumor had spread, of course, throughout the country. So it takes a long time to actually then sort of get back on track, communicate using local decision makers or local religious leaders to actually communicate to the community to ensure that they trust the vaccination program, that it's good for them. So it's a complex and very lengthy process, and that's also part of the reason we're still fighting polio in Pakistan.
So clearly, communication is a huge part of all of this initiative on both situations. I was fortunate myself to go on an NID National Immunization Day trip to India. And like you said, you know, just understanding the needs when certain countries aren't experiencing it at all. And my daughter was only 16 at the time. She said, well, that's great, you're going, Mum, but what's polio? And I think, you know, it's so hard. There was a question here actually from Jean Burbridge. She said, when did iron lung cease to be used in the UK? I don't know if you happen to know the specific answer for the UK.
I don't know. Probably when the last sort of survivors of polio that needed iron lung passed away. But there's still some polio survivors in the US I'm aware of, and I met one of them who still uses an iron lung. So, well, you know, there's a dozen of them throughout the US. So it's not sort of a totally history, although it is thankfully history fastly.
And yes, thank you. And I know we have lots of followers and ardent polio advocates out on the YouTube channel with us tonight. So I'm sure some of them may have answers to that question. But coming back to the trip I was privileged to be on, it just blew my mind, Michel, how in India we managed to eradicate polio when the infrastructure wasn't there. And yet now we have Afghanistan and Pakistan, also very hard to reach, very poor mountainous areas of sort of very mobile populations, and of course war-torn as well. So there's a question here from Jacob Senduwala, sorry if I'm not saying that quite right. What is the intended approach to reach hard to reach areas in Afghanistan and Pakistan in particular? Because clearly we want to make sure we finish this job.
So I will not minimize the issue of reaching hard to reach. It is important. but it is not the reason we're not succeeding in our eradication efforts. We know how to reach areas. We have health workers that can travel incredible distances. We've got good cold chain. We've got good technology. The starting point here, I think, is Pakistan. That's where we need to ensure that there is a true, I would say, leadership, local leadership of the country itself to actually eradicate polio. India turned around. For a long time, India represented the majority of the cases in the world. India turned around when the government of India decided they wanted to eradicate polio. And of course, the GPI, Rotarians, and so on sort of were instrumental in supporting them. But the government itself decided to do it, and they know best how to communicate to their sort of people, and how to engage a people from the political level to the grassroots level. And that's not happening in Pakistan for a number of reasons. It hasn't been happening. Afghanistan, of course, will be complicated because of the war there. Pakistan no longer has, it has tensions, but all areas of Pakistan are accessible, and there's no reason Pakistan cannot eradicate the disease if they really decide to do so. They've done an extraordinary work to fight COVID-19 throughout the country, all the provincial level, at all levels, they were engaged in fighting COVID-19. They can apply the same strategies to fight polio. If they do that, Afghanistan will actually eradicate polio quite easily. Afghanistan has already stopped indigenous transmission of the virus twice in the past, but each time they got reinfected from a virus coming from Pakistan because the population movement is so sort of important between the two countries. So, the density of the population in Afghanistan is not such that it's going to be difficult to actually stop the virus there, but we absolutely need to ensure that the massive amount of people in Pakistan get vaccinated and stop sort of the circulation of the virus.
So a couple of last questions before I hand back to Luke. Whilst we're still on Pakistan and Afghanistan, John Bembury is asking the big question: when do you expect Pakistan and Afghanistan to be free of polio? And a similar question to that, Michel, from Douglas Yates: how likely are we to be seeing the eradication of polio in Afghanistan and Pakistan before 2030? So in your very educated opinion, what are your thoughts?
Well, we've been wrong several times in the past, but we've been wrong. But each time we made progress. We were wrong when we thought that Africa was free of polio, Nigeria was free of polio, but then we eventually did it. Will we see the end of wild polio virus in Pakistan, Afghanistan before 2030? I'm convinced that this will be the case. The difficulty now, our plan was to finish by 2023. We need to revise our strategy because COVID has come in and has put basically a big hurdle on our efforts, and the virus is spreading. So it's going to be complicated. If we manage to resume activities in Pakistan and Afghanistan, at least in Pakistan, effectively, we could be seeing sort of a stabilization of the situation over the next 12 months, and then sort of diminution of the cases in 2022. And probably we could see the last case if COVID sort of does not strike again in 2023. But that's my personal guess. I think there's no reason we cannot do it. We did it in India, and everybody said it's impossible to do it in India. We'll never eradicate polio in India. And India hasn't had a case for 11 years now. So 9 years since 2011. So, it's possible, it's feasible, we're going to do it. But it's going to sort of require that we tackle also how to work in the context of the COVID pandemic without waiting too much.
Rotarians love to rise to a challenge, that's for sure. Back to you, Luke.
Sure, thanks, Michel. So just another one from me on challenges. Obviously, it's often mentioned, especially in the two remaining countries, around refusal of vaccination, that due to these countries being marginalized or even lack of education, that's where the refusal of vaccination comes from. But there's refusal of vaccinations in the UK, in the US, in more developed countries. So what kind of strategies would you implement to deal with that refusal on those levels? And where would that apply with coronavirus and potential vaccine for that?
Well, people are strange because I think that, at the moment there's a bit of a debate on a coronavirus or COVID vaccine because people feel it's going to be developed too quickly and they're not going to be too too sure that it's good or not. But I think that will pass because people will want to be vaccinated against COVID. You know, when there was an outbreak, a major outbreak of Ebola in West Africa, and we started seeing cases come into Europe and the US, everybody was asking for a vaccine.
Mm-hmm.
When HIV, if we had a vaccine against HIV, people will get vaccinated. So I think people will get vaccinated after they're reassured that the vaccine meets, you know, safety and efficacy standards. So, you know, the refusal of vaccines in our societies, in the North, in the more rich countries, is really due to the fact that we don't see the disease anymore.
Mm-hmm.
Why vaccinate my kid against measles? I've never seen measles, polio, or other diseases. But Ebola, you know, if it strikes, COVID, sort of HIV/AIDS, yes, they will sort of vaccinate their kids and they will get vaccinated. So I don't think it's the same issue. There will always be, of course, people that refuse on the basis of sort of not so much religious beliefs, but sort of I would say beliefs that it's you know, that it's their right to decide for themselves whether they want to contract the disease or not. We need the education here to actually say, well, of course, it's your right to decide whether you're going to die or not from a disease, but do you want to actually sort of transmit that disease to your wife, to your spouse, to your children because you've contracted it? So, you know, at that point, people, you know, if we educate properly without this sort of I would say frenzy about, you know, having a vaccine immediately and that people don't trust, you know, that it's been done properly, then I think people will want the vaccine. I have to say that in the countries where we work, Pakistan, Afghanistan, of course, we've got problems of refusal of the type that I've mentioned. But basically, people want vaccine. They see the disease. They want their parents to be vaccinated. In Nigeria, in Borno state, where Boko Haram was controlling the movement of people, people were sort of risking their lives to actually bring vaccine into this area or get their children out so they get vaccinated. They want vaccines because they know what the disease does to them or to their kids.
Mm. Cool. And just one more for me on a similar subject from Peter Stevanovic. He asks, if a COVID-19 vaccine is developed, what are the plans for it to be distributed worldwide? And will the polio system of distribution be used? Will there be some similarities between COVID and the polio eradication?
Yeah, the World Health Organization and its partners are doing a lot of work in planning, thinking how access to the vaccine is going to happen. First, we need to make sure that there's enough vaccine available for all countries to have equal access, and that the vaccines don't get only given to the richest or whatever. So there's a lot of work being done. I'm not at the middle of that, but once the vaccine is available and starts getting distributed, you know, first we'll have to understand who, from an epidemiological perspective, needs to be vaccinated first. It's possible that the older people should actually get the vaccine first, sort of, which is not the case for polio vaccine, right? So the target population is going to be maybe different than it is for polio. Nonetheless, the infrastructure, the health workers that are so present in many countries and funded through the polio infrastructure, as I said, they've already been extremely active, sometimes at the risk of their lives, to support the response to COVID-19. They will be engaged in the distribution and vaccination of people. Absolutely. There's no doubt about that.
Thank you, Michel. So staying on that link between polio and COVID-19, as we've set up for this tonight's talk, Maureen Benson has asked, herd immunity has played a part in eradicating polio. Can herd immunity play a part in eradicating COVID-19, in your opinion?
So herd immunity in the case of polio is different because we have been using a vaccine, which is an oral vaccine, which was sort of conferring to the kid immunized what we call mucosal immunity. And because the kid was sort of swallowing the vaccine, he was also, with a live attenuated virus, he was also excreting that virus. And by sort of contact, he was actually contaminated his siblings and people in the community who will also get vaccinated. Whereas with the COVID-19, which is unlikely to be an oral vaccine, it's going to be an injectable vaccine, probably an activated vaccine. We no longer manufacture develop vaccine live attenuated the way that we did for polio. It's unlikely we'll have sort of, if you vaccinate one person, it's unlikely that the person next door will be also protected by contact. So it's absolutely not the way it would work. And herd immunity, if you just let the virus circulate, I think is unethical, because some countries have tried that, to say, let the virus sort of spread and infect everybody, and then we'll have enough people so that the virus has no place. It's basically, in my view, in the view of WHO, unethical, because you let people die because you are sort of allowing the virus that for which you don't have a cure, for which you don't have a vaccine, you let this virus spread. So, how many people will remain if you really don't do anything to protect them against the virus until you have a vaccine or until you have a proper cure for it?
Sadly, time is racing away here, Michel, and it always goes so fast. I can't believe how fast it goes. But Clive Amos has a question here tonight that I think speaks for a lot of people in many ways. And he says, you mentioned in your opening video that you are going to retire. And he's asking, is there a champion in the World Health Organization who will continue the work with the same enthusiasm that you have brought to the project?
Well, first of all, as I said, it's a partnership. So the World Health Organization is one player in this partnership, an important one, I have to admit, but not the only player. And of course, my replacement is being recruited. And I have in my department many, many extremely dedicated and vocal people who can speak even longer than me and more sort of vocally on polio eradication. People, I have, one of my close sort of partners, my predecessor in this job, who retired and came back to the job to actually try to eradicate polio in Pakistan. That's Dr. Jaffari. He actually sort of is the person who led the effort to eradicate polio in India. So we've got extraordinary people in the program throughout the partners. Yes, absolutely.
And Michel, on that note, I mean, it must be hard for you to retire from this position when we're so close and not quite there. How does that feel for you?
Yes, it's disappointing, but it's been an extraordinary journey for me. As you said, I started with WHO in 1987. A few months later, the World Health Assembly endorsed a resolution to eradicate polio, and I was working in the immunization program then. I was sort of involved in polio eradication, but as a very junior person and looking at the big bosses sort of do the work. And finishing my career as the head of the program is extraordinary for me. It's disappointing. We've had a couple of successes during my tenure. While poliovirus type 3 was declared eradicated, Africa is now declared free of wild poliovirus. We've had sort of challenges also in Pakistan, Afghanistan, and COVID-19, which is sort of adding to the difficulties. But I'm fortunate to have been part of this adventure, and it's time for other people to take on. It's quite a challenging job. So you need to actually continue to have the energy, and I will continue with this same energy, but as at the grassroots level, as a Rotarian in my club in France, and I will take on the becoming president of that club and make sure that we sort of fundraise for Polio Plus and sort of become the best fundraising club in France.
Fantastic. What a great way to keep on with some more successes in future. Back to you, Luke.
Super. Well, all that's left to do is say a huge thank you. So thank you so much, Michel, for being our guest this evening. It was a very incredible talk. Being a Rotarian myself, I've heard so much about polio through the fundraising campaigns, through polio survivors and Rotarians coming back from the immunization projects. But I never really thought about it from the angle that you put across today. Challenges such as getting to hard to reach communities, the resistance to vaccines, and leading such an important global campaign. So thank you very much, Michel. Before we let you go, can we please ask you to share your 3 key takeaways that you'd want us all to act on?
Well, I sort of mentioned them during the discussion, and I'm sorry to repeat that, but we need to convey to everyone that vaccines work and save lives. We need to actually convey that, give example, explain to the people, be convinced about it ourselves, and sort of convince people that they should sort of support vaccination program. The second thing is, for Rotarians, we need to be proud of what has been achieved so far. Polio Plus is a great success. We can be proud of it. We actually have reached a level which of infection, which is very, very low. So, but this is also the reason we've succeeded is because of the partnership. Rotary has worked at all levels, at government level for advocacy, at the grassroots level and social mobilization, and has worked with scientists in WHO, with the Gates Foundation to multiply by 3 the funds raised and so on. So the partnership, the power of partnership is extraordinary. And we need to believe in that. And that's how we succeed together with all public and private sector together. And the third, I would say, is we cannot give up now. Janine asked, what happens if in the time of COVID we stop? We should not give up. We cannot give up. We cannot stop. We must actually go all the way and finish the job. So please continue to convey that message in your clubs. I know in my club, people say, well, polio again, polio, isn't that enough? Shouldn't we do something else? Let's do something else, but let's do also polio. Keep polio at the top of our agenda to make sure that we continue and we finish the job.
Michel, we're really very lucky that you've been able to join us tonight on such a busy week. And I know we have a lot of Rotarians and non-Rotarians hopefully joining us tonight. And these are replayed, inviting many guests. So hopefully, as a result of tonight's conversation, many more will know how they can play a part, and highlighted also in the World Polio Day event on Saturday, October 24th, when you, of course, will be back again as a guest, along with several other amazing celebrities and polio ambassadors for yet another special Rotary Great Britain event, Great Britain and Ireland. And that starts at 5:30, I believe, going on to 6:45. So please check the chat in YouTube, if you're on YouTube, for more information on that event, or register directly for free at the Rotary Great Britain Ireland event page. Thank you so much, Michel, for sharing your wisdom and insights with us all tonight. It's been lovely.
Thank you,
Michel.
Michel.
For having me. Thank you. Thank you.
Take care. Super. So please do take some time to look into the Global Polio Eradication Initiative, and especially into the End Polio Now campaign that is led by Rotary. Rotary members have contributed more than $2.1 billion and countless volunteer hours to protect over 2.5 billion children from this paralyzing disease. Rotary's advocacy efforts have also played a role in decisions by governments to contribute more than $10 billion to the effort. You can help make a difference too.
There still is a short fund in the fundraising gap. So, but thanks, Luke. We have more great events ahead of us still for Series 2. And next up is Marilyn Fitzgerald, an author and popular speaker in the field of microfinance and sustainable solutions to help end poverty, which is the first of the United Nations Sustainable Development Goals. Her topic will be more than just the money, and in our COVID-19 impacted world, our economies will definitely be suffering terribly. In fact, the United Nations has estimated that our global efforts to end the war on poverty have already been set back 10 years, and the ranks of the poor will swell by 240 to 490 million this year. Many right in the heart of our local communities will be severely impacted. So join us to find out how we can make a difference in a couple of weeks with Marilyn, and we're always better together.
Super, a really important message there, Nikki. Now to end by thanking you, our audience, for being with us tonight, asking such great questions and being here all evening. We'd like to remind you that tonight's broadcast, along with all the previous Together Talks, can be found on the Rotary in Great Britain and Ireland YouTube page, where we invite you to like and subscribe and share. And until then, it's good night from me.
And it's good night from me. Thank you all.
Bye.